So please tell me when the clip is ended.
You're live. You're live. You're live. You're live.
Let me know when the clip is over.
I'm not playing. I'm not. We are live. Just start. We are live. Just start.
Oh. Hello, everyone. Welcome to Real Men's Talk, where it is sizzling hot, interactive and transforming. On this episode, we are looking at the topic mental health. Our conversation will be on mental health. So as documented, your mental health is important. Your mental health is an important part of your overall health and well-being. You need good mental health to help you get through life challenges, to have healthy relationship with others and enjoy life. And on this conversation I have with my co-host as we dive into the conversation. Dr. Femi Samo. Good evening, sir.
Good evening, dear. Good evening, everyone.
And we also have on set.
It's not on studio.
He's not because it's frozen here. I can't see the live shot. And we have a special guest here with us. We have Dr. Oludare Adewuya. He's our special guest on this conversation. Dr. Adewuya studied medicine and surgery and graduated from the University of Ibadan. After his housemanship NYSC, he decided to specialize in the mental health. And he currently works in the Federal Medical Center, or as a senior registrar in psychiatry. He's also the editor-in-chief of the Association of Resident Doctors, Federal Medical Center. His area of interest include child and adolescent psychiatry and forensic psychiatry. He is a lover of music and sports. The writer and the author of a book. It's never used to be this way. Welcome, Dr.
Adewuya. Thank you very much, Mama T.
Dr. Adewuya.
Yes, thank you very much, Mama T. Thank you very much, Dr. Samuel, and good evening, viewer. Thank you for having me.
Yeah. As we dive into the conversation today, men's mental health. Am I echoing from them?
No. Yeah.
Okay, it's echoing here. Okay, so I can move faster. I'm trying to move slowly so that you can hear me because of the head. Why is mental health important? Or why is it important to talk about mental health? I'm going to go to Dr. Adewuya.
Okay, thank you very much. From the definition of mental health, you talked about a few aspects of it. We talk about somebody being well, both socially, physically, and psychologically. and you're talking about somebody being able to realize their abilities. You know what you can do, what you cannot do. You realize your gifts, your talents, the things you can do, and you're also able to work productively. You are doing well in your place of work. You are doing well in your business, and you are also able to cope with normal everyday stress. What I mean by normal everyday stress is you have to go to work, you have to go to school, you have to pay your rent. Some people cannot cope with all this, and it's a risk factor for mental illness, and also being able to make contribution to the community. So when you look at all this is what we call mental health. So somebody being able to realize their abilities, somebody being able to cope with stress, somebody being productive in what they do, and somebody making an impact in the society. That is like the totality of a man's life. So when we're talking about mental health, we're talking about every aspect of your life, the way you live from day to day, the way you cope with challenges, and the way you are able to use your abilities to get the things you need in life. So mental health is very important. You cannot say you are healthy when you don't have good mental health. And one of my consultants used to say that there is no health without mental health. Somebody who cannot cope with basic things in life, basic challenges in life, that person cannot be in optimal mental health. That person may be at a risk of having one mental health issue or the other. So mental health is very important because even the physical illnesses, some of them take time before they even kill people. But mental health, somebody can have a depressive disorder, and before you know it, he has committed suicide, he has ended his life. So mental health is very important. It affects physical health, it affects productivity, it affects relationship, it affects every aspect of life. So mental health cannot be overemphasized, and it's very important. We should take it more seriously than we have been doing before.
Okay, can you hear me now?
Yes, I can.
Okay, I think you're done.
Yes, I'm done.
Okay. Were you able to talk about the importance of why we have to talk about mental health?
No, I didn't talk about that. Yes. Okay, when we now talk about mental health relating to men, I think this is very, very important because over time, we have neglected the aspect of men's mental health because people believe that men should not have mental health problems, but this is not true. Over time, we have been able to see from research that men have a lot of mental health problems. People expect men to be strong. They expect men to be able to deal with life issues. They expect men to be immortal and unmovable by life's challenges, but this is not true. And this is actually having a lot of negative impact on the men because if as a man I cannot boldly come out and say I am being abused in my relationship, if as a man I cannot come out and say I'm depressed, if as a man I cannot come out and say I have been raped, if as a man I cannot come out and say I am afraid, then how do I solve the problem? Because the fact that I'm a man does not mean that I'm not going to have these challenges. But when I have these challenges, how do I go about it? So over time, we have neglected the issue of men's mental health because we expect them to be able to deal with their problem. And it's a society problem. It's a stereotype that men should be strong. But this is not true. We are all human beings. We have blood flowing through our veins. We have emotions. And many men, because of this, they hide their problems or they use maladaptive coping strategies. They take substances, they commit suicide, and they do a lot of things that are not good for their own psychological well-being. And this is also causing a lot of problems in the world right now because men are really dying before their time because they have problems they cannot share, they cannot look for solutions. And I think it's high time we started taking the issue of men's mental health seriously.
Thank you so much, sir.
You're welcome.
Okay. Dr. Samuel, What have those things or situations that can affect a man's mental health?
I can't hear you, sir.
I think he's trying to unmute himself.
All right.
Dr. Adewiya, can you please address why
Okay. I think you are talking about things that can affect men's mental health.
Yes.
So if I'm to talk about this, yes. When we talk about mental health, there's nothing like cause and effect in mental health. There's nothing like this is what is causing this. We have people who are vulnerable, who are susceptible, who are prone to having mental illness, and we now have risk factors for that mental illness. So when somebody who is susceptible to having a mental illness now has risk factors, that individual is more likely to come down with mental illness. What do I mean? People who are susceptible to having mental illness, maybe somebody who during conception, when he or she was in the womb, the mother had an infection, or during birth there was trauma and things like that, or during childhood there was a lot of abuse, physical abuse, sexual abuse, and the rest like that. These people are actually vulnerable to developing mental illness later in life. So when this person now grows up, becomes goes to school, is unable to get a job, has a relationship problem, because it's already vulnerable. Now there's a risk factor. It comes down with an illness. So when we talk about the risk factors, there's no particular cause for mental illness, but there are a lot of risk factors that can come together. A single risk factor may be enough to cause somebody to come down with a mental illness, and it could be a combination of several risk factors. So these situations, we divide them into biological, psychological, and social. For the biological, when you look at the men, you look at even from the time they are growing up, men, for male, the brain growth, the growth of the brain is not as rapid as that of female. The female brain grows faster, becomes mature faster than that of male. So you will discover that most mental illnesses in childhood, they are more common in males compared to females. And for a developing brain that has gone through a lot of maybe stress, abuse, or one thing or the other, that is a risk factor on its own. People with nutritional problems, like people who are not taking enough vitamins, and people who drink a lot, who have vitamin B12, vitamin B6 deficiencies, this can predispose to mental illness later in life. And also trauma is a very, very important factor in terms of the biological risk factor. Men are more prone to accidents, either at the place of work, either vehicular accidents, and this also affects the functioning of the brain. Mental illness has to do basically with a deficiency in the functioning of the brain. And when we look at psychological risk factors, we talk about how the individual views himself, how the individual thinks about himself, thinks about his environment, thinks about the world at large. And we notice that because of the expectations of the society on men, they tend to criticize themselves a lot. They tend to set a higher standard for themselves. For example, a man who maybe is working, is earning like $1 million, and all of a sudden he loses his job. The man starts to feel like it doesn't amount to anything, is useless to his family, because the society believes that he should be the one to provide for his family. So when he believes that he can no longer do that, he starts to look down on himself, and before you know it, he starts to entertain a lot of things, and that could lead to mental illness. So men are usually very critical, and they set a lot of expectations for themselves. And also, there are a lot of cognitive errors. Cognitive errors has to do with the way you look at yourself, the way you think about yourself, and there are a lot of them. And these are psychological risk factors. Then social risk factors. This has to do with the people around you, your immediate environment, Are they hostile people? Are they people that fight all the time? All these things contribute to mental illness. Problems with finances, money issue, especially in today's world. Money is a big problem. Everybody is trying to compete. Everybody is trying to make money. And if you don't have money, you feel so low. You feel so down. And even relationships. Somebody who is divorced, somebody who is separated, somebody who just lost a spouse. These are risk factors for mental illness. Somebody who is lonely, somebody who's undergoing a lot of stress at place of work, somebody who lost his job, a lot of risk factors. Even the country we live in, the stress you have to go through every day is a risk factor for mental illness. You have to struggle for everything. All these, when you put them together, they are risk factors for mental illness. But the fact that they are risk factors does not mean that everybody exposed to them will come down with a mental illness. That's where the issue of individual vulnerability now comes in. So when you see a vulnerable person, a susceptible person now having risk factors, the person is likely going to come down with a mental illness.
Thank you so much.
Thank you so much, sir.
So, like in the line, how can our cultural attitude affect men's mental health? How has it affected them?
Okay. Thank you very much for that question. Like I said before, in our culture, people don't believe that a man should be weak, a man should be sick, a man should feel down, a man should be anxious. People believe that a man should be able to keep it together. So when a man is having symptoms of depression, maybe low mood, loss of interest, weakness, people just tell him, man up, buckle up, and things like that. That is making things worse. That man is not likely to come to the hospital to see a psychiatrist. And even our cultural practices too. We are very religious in Nigeria. So when you are having a challenge, a mental health challenge, people believe that maybe you must have sinned against God. And by the time you go to people, talk to people, they tell you that you must have done something wrong. And they condemn you the more instead of giving you psychological support and telling you to go to the appropriate quarter. So all these practices and even the stigma that is associated with mental illness makes people not even want to seek for solutions. So when people have these problems, they just keep it to themselves. The way people even look at people with mental illness in this society, everybody thinks that mental illness has to do with psychosis or schizophrenia, like the typical man you see on the streets. But no, mental illness is broader. It has to do with how you sleep, how you wake up, how you eat, how you view yourself in terms of your sexuality, your gender roles, a lot of things, the use of substance and things like that. Mental illness cuts across board. It's not just psychosis and schizophrenia alone. So somebody who is just having maybe anxiety problems, he looks at himself that, will I go to that place where people with psychosis and schizophrenia are going to? And even when you come to the hospital environment, the moment they see you display any form of abnormal behavior, you say you want to see a psychiatrist, people start looking at you in another way. And all these things go a long way in making sure that people who have mental illness just stay on their own or look for spiritual solutions that will not work, or even just look for ways to cope. Like I talked about maladaptive coping skills that even add to the problem. You are trying to solve a problem, but you are creating another problem, like use of cannabis, use of alcohol. So at the end of the day, the problem becomes worse, and the individual doesn't get better at all. So I think all these practices, all these beliefs that we need to change, all these attitudes towards people with mental health challenges, they really need to change, because they are really contributing a lot to the rising incidence of mental illness in our society.
Thank you so much. Dr. So what are the implications of mental illness?
Okay, the implications of mental illness can be diverse. It can be on the individual, it can be on the family members, it can be on the entire community. For the individual who has a mental illness, that person's productivity is reduced. If the person is working, like a doctor now who probably has a psychotic illness, the person will need to be treated, And even the length of treatment can take up to 6 weeks in the hospital before the person is being discharged. So for that period, productivity is zero from that person. And that person can risk losing his or her job. That person can risk losing his or her wife, his wife or her husband. I've seen patients that they had the first episode of mental illness, we admit them. By the time they are going back home, they are coming for follow-up. How about your wife? They tell you that their wife has left them. How about your husband? We don't know where he is. Those are things that happen to people with mental illness, and it's something that our society needs to look into. The fact that somebody has an episode of mental illness does not make the person mentally ill for life. People can have episode of mental illness, and it's not because they've done anything wrong. And other implications also include the fact that people don't even want to give them accommodation. Normal rights that people should enjoy, they don't give them. Sometimes they don't allow them to vote. They don't allow them to be voted for. We've seen a lot of, like 2 major cases in this country where some people are dragged to court on the premise of the fact that they've been treated for one mental illness or the other in the past. So this has a lot of implications on the individual, on the family members too. The stigma is also extends to the family member because the people feel that mental illness is contagious. Like if you move closer to them, you're likely going to contract whatever is going on with them, but it's not true. So their family members are also stigmatized, and also a lot of their privileges are taken away from them as a result of that. And even caring for somebody with mental illness can be very, very challenging, because when people have mental illness, for example, if somebody has delusions, false beliefs, or beliefs that are not logical, the person may feel that his wife is trying to kill him. And before you know it, the aggression is directed towards the wife. So usually relatives are the first set of people to feel the impact of the mental illness. When the individual cannot sleep at night, it's the family members. And even when the person comes to the hospital, family members go through a lot. There is what we call the caregiver burden. If you need something, it's family members that get it, especially in this part of the world when there is no insurance. So the family members have to be running up and down, coupled with the fact that they face stigma from the society, and the society at large too also bears the brunt too, because the more people are being stigmatized, the more people are likely to come down with mental illness and not look for solutions. We've seen communities where we have intervened, and the people are better for it because they know the telltale signs of mental illness and they know what to do. They come to the hospital and we give them treatment. So the implications actually covers everyone, including the person, the family members, the entire society. Even we that we are mental health practitioners, we also have the implications, because people feel that we are eccentric people. They feel that we are more or less like our patients, and sometimes when you talk to your colleagues, they feel like this one is psycho. So the implications are much actually, but we hope that with more enlightenment, with more orientation and reorientation, we are going to get there. Thank you.
That's serious. We hope to get a better place where the stigma is no longer there. People are treated like the person. So in that case, what are your advice for men resistant about seeking help on their mental health?
Okay, my advice to them will be that the concept of macho man does not exist. It does not. There is no macho man, there is no invincible man, there is no immortal man. It's only God that is invincible. So if you have a problem, speak up. Talk to a doctor. The doctor does not have to be a psychiatrist. Based on what you tell that doctor, the doctor will be able to refer you appropriately. Now, if you have people around you and you need psychological support from them, talk to people around you. If it's your wife that you need psychological support from, don't be shy of being a child, because there are life situations that will make you look like you're a child. No matter how old you are, there are things that you are seeing for the first time. There are things that you are experiencing for the first time. At that moment, you are not an old man. You're not a consultant. You're not a professor. You are a child because you are facing it for the first time. You may not be able to deal with it. And that's when you come out and say, I need help. A lot of men are suffering in silence, and it's not supposed to be. And when you see a man becoming irritable, when you see a man becoming aggressive, the object of the aggression is not the problem. The man is going through something, but he doesn't want to say, so he's transferring that aggression. But it's not supposed to be, because it makes things worse. So I think men should speak up and should admit we are all human beings. There's nothing that affects women that does not affect men. In fact, even depression that was said to be more common in women, studies have shown that there is really no much difference between male and female. The only problem is the only difference is because women come to the hospital more than men. That's the only difference. So there is nothing that happens to women that doesn't happen to men. And even when you try to be a macho man, you try to be over spiritual. In the Bible, Elijah was depressed when even after he had conquered the prophet of Baal, the Jezebel told him, I'm going to kill you. And he ran away, and he started saying a lot of things. At that point, he was depressed. He was hopeless. He started telling God, God, take my life. He was suicidal at that point. And that was the man that was powerful, that could call fire from heaven. But he was able to open up and say, God, just take my life. I don't think I can handle this. And if Elijah can do that, then who are we? That means nobody is invincible. We should be able to talk to someone. We should be able to see a doctor. And when we are seeing doctors too, men have this habit of hiding the problem. And the Nigerian health system is overwhelmed. So a man has problems with anxiety, is telling you that he has headache, he has body pains. And you have to probe deeply until he's able to voice that this is the main problem. So I think there is no harm in speaking up that there's a problem. We are all human beings, and there is beauty in our imperfection. So let's accept ourselves for who we are. We are not all the same. Some of us have various susceptibility to different things. Some of us cannot cope with different things. So we should be able to love ourselves for who we are, and also be able to come out and speak and tell people who can help us about our problems.
Thank you so much.
Thank
Dr.
you so much,
Adewuye.
Dr. Adewuye. You're welcome.
So in line with that, how can a man deal with fear, speaking out as a fear of being judged?
Okay. Okay, I will say that there is no particular way of dealing with it. It's just like if somebody comes to me as a psychiatrist and say, Doctor, I've written an exam. I'm not sure I will pass. The two questions I will ask as a psychiatrist is, what will happen if you pass? And what will happen if you don't pass? Because whether you pass or not is no longer in your hands. Now, there are some things we cannot change about the society. You can say people will judge you. What if they don't judge you? What if they judge you? So what happens after they have judged you? So by the time you answer these questions appropriately, you now realize that it really does not make any difference. Whether people saw you going to see a psychiatrist or not, whether people knew that you are admitted, it really does not make any difference. And people should, men especially, should learn the habit of coming out to speak. Just take that bold step. You are doing it for your own good. You are doing it for your own mental health. So people may gossip about you, people may talk about you, but if your mental health becomes better for it, it's your plus, it's your advantage. So anything that you know that will help you, even if it makes you look like a fool, even if people look down on you, because even the people looking down on you have their own challenges, but they are not just bold enough to come out and look for help. I don't think anybody should join that bandwagon, or people who just look at others and analyze what is going on in the life of others, because at the end of the day, it's your life. Whatever comes out of it is up to you. So I think men should not look at what people are saying in the society. Usually this fear is fear of what people will say or what people will do when they discover that I'm seeing a psychiatrist. But in the real sense, these things don't matter, because many of these people that you think that will say something may not even remember. They have their own problems they're dealing with. And you may be surprised that their own problems are even bigger than your own problems. So I think men should just take the bull by the horn. The advocacy is ongoing, and I think men should come out and speak up when they have mental health challenges.
Thank you so much. Thank you so much. At what point should someone seek professional help? I'm not sure if you can still hear me.
Sorry, Mama T, a call came in. Sorry, I got a call. Sorry. So okay, we can continue.
At what point should a man seek professional help?
Okay. This is very interesting. At a point when you notice that you are no longer who you used to be, as in you are no longer at your optimum level. Okay, when a man starts seeing that I'm going through a lot of stress, I cannot cope with this stress, or you are in a lot of distress that you know you can no longer cope with, or you are becoming irritable without any particular reason, you are losing interest in things you used to enjoy doing, you are no longer as happy as you used to be, things that should keep you fired up, motivated, no longer motivate you. At the point where your interpersonal relationship with other people is being affected, at the point where your productivity at work is being affected, at the point where emotions are overwhelming you, like maybe two sons of a deceased individual may not react the same way. Maybe one may cry for a week and it will be fine. The other may not be able to cope. So at that point where you realize that I'm not sure I'm coping well, because whether we like it or not, the truth of the matter is that you will know when you are not coping well. You will know when you are not dealing with the issues well. So when there are issues and you know that I'm not dealing with this well, this has made me to be a different version of me. Or when you realize that people are complaining about you, that your personality, maybe something is changing about you, or maybe your actions is even causing distress to other people, that's when you should look for help. When you realize that things that do not used to bother you, that do not used to get to you, are now becoming increasingly very important, unnecessary things, or when you discover that your attitude has changed, maybe you lock your door once before, now you lock your door 10 times, and things that you don't used to do, any deviation from what was normal for you, because normal is different for everybody. My own normal is not your own normal. So when you discover any difference, any deviation from that normal in terms of your behavior, your mood, the way you think about things, the way you deal with issues, the way you perceive things, the way you interact with people, that is when you should start seeking for help.
Thank you so much, Dr. Darian.
You're welcome.
I want to hold on to this, that when your action is causing distress to other people, it's so profound. So looking at that, sometimes some people can say that this is the cause of their problem. Probably somebody that lost a job and has been trying to get another job, and this person is depressed. Obviously, it's going to affect the finances of that person. And this person realized that, oh, I am depressed, and the problem is because there's no income. And that person feels like, I'm depressed because I don't have money, and you're asking me to see a psychiatrist, is he going to give me money? Is it going to give me a job? They're not going to solve my problem. So what's your advice for people like that? Why do you think, what do we tell such people that for this reason you need to see a psychiatrist, because they'll say that it's not going to solve my problem. So why should I go for professional help?
I need money.
Okay. Well,
I need money
like
now.
you.
How will you help me?
Okay, sir. Like you said, the individual feels that this is the cause of the problem. But when you see a psychiatrist, an average psychiatric history takes about 2 hours. What you think is the problem may not be the problem. So you only have an idea of what you think the problem is. But by the time you see a psychiatrist who takes a thorough history, our history goes from when you are born till when we are seeing you. And a psychiatrist is a professional who can look at gaps, who can look at things that are not consistent. So the person lost a job. You want to find out there's an occupation history. So all the jobs the person has done, let's assume this person is maybe leaving the 10th job. The important thing at that point is not getting another job, is why are you leaving these jobs? The problem may even be relationship problems, maybe problems with concentration, maybe problems with anxiety, maybe problems with substance use, maybe problems with cannabis dependence. So even though you have an idea of what you think the problem is, you still need a professional to be able to look at you holistically. Because when we have problems, that's why they say a doctor should not treat himself or his relatives. When you are sentimental, when you are emotional about things, you can't see clearly. So let somebody who can see more clearly diagnose you and say, okay, this is where we go. Because even in the course of saying, okay, I need money, by the time the person goes maybe for psychotherapy, we may be able to discover a lot of other things that will make the person achieve a more optimal mental health. It's not just about, this is, like I said before, mental illness is not cause and effect. I lost my job, that's why I'm depressed. No. The loss of job is just a risk factor for the depression, and does not necessarily mean that that's what's causing the depression. So when we see people in psychiatry, we look at people holistically. So that holistic approach cannot be swept under the carpet because the person feels that he knows the cause of the problem. Whatever the person is thinking may not be correct.
Thank you so much. So can over-expectation affect someone's mental health?
Yes. By over-expectation, you mean setting too high standards.
Yes. That's
the major cause of low self-esteem and social phobia. Now, people who have low self-esteem, they are very critical of themselves and they expect too much from themselves. Somebody who has low self-esteem, for example, if he scores 70 in a test, is not happy because he feels that he's supposed to score 90, even if the highest mark was 82. So that person will always set too high standards for themselves. People like that also make light of their own achievements. Maybe as I'm talking to you now, I'm telling myself that, what am I even saying? And after the program, I call you and say, Pharmacy, how did I do? And you said, I did well. And I'm saying, are you sure? I don't think so. And maybe you called me and said, Dr. Adeoya, you did very well and things like that. And I'm still doubting it. And Dr. Samuel too calls me. Dr. Adeoya, I think he was very wonderful. And I'm like, am I sure? I mean, those things actually cause, they predispose people to mental illness. Low self-esteem in itself is not a psychiatric diagnosis, but it's common in people with mental illness. And people like that, when you praise them, they don't believe. But when they do well, they don't feel they have done well because they keep setting high standards, and that's why their performance is usually affected because they just believe that they cannot measure up. And that's that's one of the psychological risk factors. Those are the cognitive errors. Let me give you some examples of cognitive errors, like all or none cognitive error, like It's either everybody is rich or everybody is poor. There is nothing like I wish you work hard or things like that. Or maybe let me give you maybe like overgeneralization. Okay, maybe a few days ago there was robbery on Ishuemure Expressway. That means that if I'm going from Owo to Benin, something will happen like that too. So a lot of cognitive errors come from over expectation, and is a major risk factor for low self-esteem, depressive illness, anxiety problem, social phobia, where people now come on stage because they've set too high standards for themselves and they believe that they cannot do well. They start performing woefully when it's time to even face life situations or even social gatherings. So it's a very, very major problem, even for the men who have to perform. Because for a man to be able to be a real man, the man needs to do well in his place of work. And if the man, like maybe men who are working in places where they set targets for them, some people will now set their own targets, will be like times 5 of the target that is being set for them. All in a bid that, okay, if you shoot, aim for the moon. If you don't shoot the moon, you land among the stars. All these things are not needed actually. So, and it puts too much pressure on the individual, and it affects their self-worth, their self-esteem, and is a major risk factor for mental illness.
Thank you so much, Dr. Darian.
You're welcome.
So now advising the female, how should a partner, a wife, sister, friend, or mother talk to a male about his mental health? How can they help that person?
Okay, thank you very much. I've mentioned some. It starts from when a male is being raised. There's a concept called toxic masculinity, that you expect a man to be in charge of everything, and you don't raise a male child differently from a female child. They are both children. You don't place too much expectations on the male child, no. And even though there are gender roles, it doesn't mean that a male child should be treated differently from a female child. And apart from that, when the individual now has a wife, the wife should be supportive. Men will not want to share their problems, but if they know that if they have somebody constantly asking them, my husband, how are you doing? Is anything bothering you? By the time you knock the door like 4 or 5 times, it will open. But if you just assume that the man has it together, usually men have this feeling that I want to be the protector of my family. And in doing that, they hide their own emotions so that they can be there for the family. A man that has not eaten will not tell you he has not eaten because he's more concerned about his family. But in as much as we are saying that this is not supposed to be, the spouses can also help. The women can also help by asking how the men are feeling. Usually, men, even though I'm a man, so even though we pretend as if we can hide our feelings, we cannot actually hide it. If you show in a way, it's either you are not showing interest in things that you normally do, or maybe you are not as romantic as you used to be, or you become unnecessarily angry. It will show. So I think women can pick up these signs, and even when there is nothing to pick up, you can ask, how are you doing? Hope nothing is bothering you. By the time you keep doing it, the man knows that, okay, this woman cares. So if he has a problem tomorrow, he'll be the first person he will tell. And sincerely, men can be like babies too. Men can cry and they need support, just like women. And I will encourage women to always be on the lookout, because the first primary support system for a man is the wife. It's the wife that is closest to his wife, that he sleeps on the same bed with, and things like that. So the wife must be alert. And I think in doing that, I think my also another piece of advice for the women would be that I don't know how to put this, but I will try. I think when a man sees a woman being emotionally down all the time, he is conditioned to always keep his own emotions together for the woman. So the woman should try as much as possible to also make the man realize that if you need me, I'm here.
Yeah.
We should always reassure the men that if you need me, I'm here. Because that conditioned system that this man no emotion, so he's not moved. It's me that can be moved. But when you tell him that, okay, if anything is moving you, I'm here, he knows that yes, he has a pillar of support. And when men go through challenges, it's good that they receive support and not insults. If a man loses his job, his ego is down. If you say anything to that man, he's going to get angry because he feels that, is it because I don't have a job? Can you say this to me when I was bringing in money? A lot of cognitive errors. The man's thinking is disturbed at that point, and he feels that everything you are doing is to disrespect him. So that's when a man needs a lot of emotional and psychological support. And some things like, don't you see what your mates are doing, things like that, those are things that should not be said to a man. The man may look like he's not disturbed, that this thing is not touching him, but actually it's actually touching the man. He may not show it, but it's getting to him and he's thinking, what can I do? I need to show this woman that I'm a real man and things like that. In terms of a man's responsibility in the house, even in terms of dropping money, even in terms of his sexual performance, if he's not doing well, you don't throw it at his face that you're not doing well, all those things. Those are things that bring down the ego of men. So I believe that women should help men psychologically, especially when they are down. And even when they don't look like they are down, we should show that we care and that we are always there for them. And we know that they are human beings like us who can have emotional problems at one point or the other.
Thank you so much, Dr. Adeboye. I'd like to also add that, many people cannot put a name to what is wrong with them or what they are feeling. So what is the place of help?
Hello? Hello, please come again with the question.
The many cannot put a name to what is wrong with them or what they are feeling. So what is the place of emotional intelligence in mental health?
Okay, emotional intelligence on the part of people around them or on the part of the doctors they come to see? On whose part now? Or both?
On the person, the individual.
Okay. I'm not sure I got your question correctly. Can you give me an example, please?
I've been able to figure out what is like somebody who comes to see you and the person cannot say exactly what is wrong with him or her. They can't put a name to what is wrong with them.
See me as a doctor, right?
Yes. So because they can't they can't describe what the problem is. They just know that they are irritable. They can't just figure it out. They just know. Some people just tell you, I just know I'm not doing well. That's all they can tell you.
Okay, I get your question now. There's actually something called alexithymia in psychiatry. That means the person cannot describe their own emotions. Yes. So, but by the time you ask relevant questions, you'll be able to find out what the individual is feeling. Usually when people come like that, they cannot describe what they are feeling. They are likely going to have what we call a psychosomatic disorder. Usually they have an underlying psychological problem, and they come to you, they start complaining of headache, stomach pain, something crawling in their body. And by the time you ask relevant questions, you realize that nothing is adding up. Then you go ahead and ask about, how is your work? How is your family? And you ask about maybe their financial state. By the time you ask questions around all these areas, finances, career, family, a lot of things, by the time you ask, even it might be a joke, which town are you from? Are you related to so person? Are you from the royal family? By the time you ask all these questions, that's why psychiatric history takes a long time. By the time you even have normal conversations, what football club do you support? At one point or the other, something will come up and they will now start telling you exactly what they are going through. Actually, when they tell you that they don't know what they are feeling, it's actually because at the initial stage there is this resistance. They don't want to tell you exactly what is going on with them. So by the time you get to a point in the interaction, and sometimes you may even forget about trying to be a doctor. You may just interact with them as maybe as a friend or as somebody that just wants to chat with them. Before you know it, it's part of the things we use in psychoanalysis. You just look at where they are taking a pause. You look at their expressions. You look at where they are frowning their face. You mention some things, and the person is like, "I don't want to talk about this." By the time you you use all those techniques, which a psychiatrist is supposed to have, you'll be able to find out what is going on with them. You may not be sure, but you will be able to scratch the surface, and that's why when we see patients in psychiatry, we don't expect to solve their problems in a day. In fact, some people, you may not get the entire history in a day. So people like that, when you see them, they may not be able to explain, yes. But over time with interaction, you make them feel at home. There's something we call a therapeutic rapport, therapeutic relationship. Make the person feel at home. Before you know it, the person starts to tell you how they feel. And by asking relevant questions, you'll be able to decipher what exactly is going on with that individual.
Thank you so much. So as we are running up, what self-care measures should a man take to care for his mental health?
Okay. This I will also break down into biological, psychological, and social. For biological, eat good food, balanced diet. Don't starve yourself. Don't, because you are working too hard, forget to take care of your health. Eat fruits, vegetables, take a healthy diet, drink a lot of water, have adequate rest, sleep well, and also take care of your physical well-being. There's actually a link between physical well-being and mental well-being. People with physical illnesses like diabetes, hypertension are prone to having mental illness, and also the same goes the other way too. So take care of your physical health. Then psychological, all this like you said, over expectation, all those things, we really need to tone down on the way we analyze the world. Many people are analysts, and the way they analyze issues makes things to be more complicated. You have been analyzing these problems, and the problems have not been solved. I think it's high time that we stop overthinking and over criticizing, and even all these setting too high standards for ourselves, all these cognitive errors. These are things we can work on. Then the social, your relationship with other people is very, very important. You need a close circle of friends and loved ones, because you are going to need them at one point or the other. You need, if you are the spiritually inclined person, take your religion seriously, because whether you like it or at one point or the other, it might just be your pillar of support. Be in good relationship with your siblings, with your friends, with your spouse. Have time for your children, have time for yourself, relax, take a vacation. Things that just relax you mentally, things that make you tone down on this on the issues of life, because whether we like it or not, we cannot solve all the issues of life. So sometimes we just have to do our best and not neglect the things that are important, because a man has things that will make him happy, and the things that can make a man happy is well-being, is the people around him, his job, and his relationships. So when we take care of these things, then our mental health also improves. Like I said, mental health has to do with realizing your own abilities, and also being fruitful and productive, and being able to cope with stress. And under being able to know your abilities, in this day and age, don't do more than you can, don't bite more than you can chew. A lot of people have been indebted. A lot of people are going through a lot of things that they have put their hands into things that they cannot afford. So just live your life. You are not trying to impress anybody. Be at peace with where you are. People will always say there's somebody ahead of you, no matter how rich you are. There's somebody below you, no matter how poor you are. Just be happy. Be happy with where you are while you are striving for better things. But don't let the fact that you want to be better or you want to achieve something now rob you of your happiness. Because nothing, no matter what you achieve in this world, if your mental health is not intact, then it's nothing. Because there is no health without mental health. There are so many rich people who have committed suicide. Then you now start to wonder, what have they not achieved in life? It's because when you sacrifice your mental health for achievement, at the end of the day, the achievement will never satisfy you. So I think we should manage our expectations, and when we are even pursuing our goals, we should take it easy on ourselves, on our mental health. So I think by the time we do all this, we take care of our bodies, we take care of our soul, our brain, and we also take care of things around us. We are happy. We do things that make us happy. I mean, I think we'll have a good mental health. And exercise for the men is very important. Exercise for the men is very, very important.
Thank you so much, Dr. Adewuya. Is Dr. Samuel still there? I've been frozen all through, so I can't see anything. Is Dr. Samuel there? Dr. Samuel, are you there? Dr. Adewuya, is it there?
Well, he's on audio, but I can't see his video.
Yes.
Okay,
yes,
he's back
yes,
now. He's back now.
Okay. All right, sir. Do you have anything to add or questions to ask Dr. Adewuya?
No, I'm not a psychiatrist, and I don't. Not at all. I've been educated. I'm not a psychiatrist, and I don't intend to be one. My last contact with psychiatry was when I was going to be posting in mental health, and since then, not at all. Dr. Adewuya, thank you very much. Dr. Adewuya is no more on the, maybe the network will tell him out. Hello? 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 Hello?
Hello, sir. Hello, sir. Hello. Hello, sir. Can you hear me, sir?
Hello, Dr. Adewuya.
Yes, I can hear you, sir.
Network will tell you out. Yeah, but thank God. Yes, loud and clear. Yes, network. Oh, yeah.
Sorry, Chief.
Thank you very much, Dr. Adumuya.
Yes, sir.
Yes.